Good morning. My good wishes to the clients of Doc Plexus. Been doing a wonderful academic service to the medical profession of our great nation. See, I would like to discuss, rather convey a few important issues to our doctor colleagues. The one is about the environmental science. It's a fast emerging science which has given lot of inputs to us how to prevent and control not only communicable diseases but non-communicable diseases also. When infectious diseases were very prominent, this particular segment did not gain much prominence. But when non-communicable diseases have started ruling the world, a lot of emphasis has been kept on this science. By that, what we mean? See, today we live in spaces or places which have been modified or created by human beings. For example, you live in a house and you work in a place and you relax and recreate in a place, or even you go for your worship, religious. That's all a building is there, which is not natural, which has been created or modified by the human being. Now this science analyzes how these building spaces are contributing to the health or ill health of the people who are living inside. You may all wonder, we are living in our house for so many years, why this problem has come now? Today's issues are changing. Now this built environment and its contribution to ill health has been well documented, and even United Nations in its high level meeting has declared that the building science has to be changed. Then only we will be able to conquer non-communicable disease. It is a very vast subject. I will just put it very crispy under certain headings. Number one, when there is a built environment, that built environment, you have an interior environment and an exterior environment. In interior environment, you have lot of artificial material like cement and bricks, wood and whatnot. And when you want to do an interior decoration, lot of insulations, lot of materials come in, like the plaster of Paris. All these things produce an entity called as pollutions. We call it technically anthropogens. These things can be small particulate matter. They enter into our body through whichever route it goes, through the nose or hand, food, whatever it goes, and it creates an inflammation. Without an infection, inflammation is there. It is called as metaflasion. That causes you lot of issues. This is one. Secondly, the way in which today the life inside office or house has gone is, you just sit there, put your earphones and sit on a computer, keep on doing it, keep on listening it. That is, the movement is restricted, or rather the accessibility is restricted. When there is a movement restriction, always we know that it is a cause or predisposing factor to non-communicable disease. The third important thing is the transportation. See, today the urban transition is fastly growing. Everybody wants to go and live in a urban area, which was 37% I think about 20-25 years ago. It is expected to be 72% by 2020, that is only one more year. Then it goes there, access is becoming an issue, and the transportation is becoming an issue. Today you will have to believe on some type of a transport, either a two-wheeler or four-wheeler, public transport, or your own transport, and this reduces the walkability and bikeability of the city. Cities are all created, there is no space. Today you cannot even travel by a four-wheeler from your house to your office. You will have to go and leave it in a public transport system and get into it. You go to your office, come and pick up, that's all. You don't walk at all. And when we plan a city, there are two names which are very important. All developed nations are following it. One is walkability and bikeability. Are we concentrating on the walking path of the human beings or even biking path of it? It is not being concentrated. Therefore, there is no physical activity. WHO calls it as a physical inactivity. The third component is access to food. Today, everybody is on artificial food. Nobody wants to make a cooking there. They just go to office and get some high level food and just close it and come back home to sleep off. So therefore, the food is becoming an issue. The fourth issue is you don't know who is residing in your neighboring flat. I have experienced it many times. I go to a place and then knock the door and I want to know where this particular gentleman is there. She immediately says, I don't know. Yeah, then your linkages to the neighbor, human beings, are very much limited. Most of them are living lonely. Now this automatically leads to a mental health problem. Today depression is most common, nearly about 72% it is common. That way it comes. Like that it adds up to non-communicable diseases. And all these anthropogens, when they enter into the endothelial cells, they promote an insulin resistance and diabetes. And in a ideal situation, what a human being does, he gets an access to alcohol. Enormous malls are there, or goes to smoke, and there is physical inactivity. There is high calorie food. Now all of them end up in a cardiovascular disease. Now diabetes, obesity, cardiovascular disease, and lot of pollution is coming in, and either it is a vehicle pollution or air pollution, goes to a chronic obstructive pulmonary disease, and then mental health also. All of them cause you a lot of non-communicable diseases. Unless you make a change here, non-communicable disease, we say you will have to walk, you will have to eat a healthy food, don't smoke, don't consume alcohol, but not going to work. The environment where you live, where you work, where you recreate has to be changed. That is the main thing. And you have slums, not only in villages. Today you have it in the city also. You move from a airport to the interior city, what do you see? Maximum slum. The socio-economic disparity, we are called as urban slums. They have more infections than rural slums. Therefore, communicable disease is also there. Therefore, built environment, ladies and gentlemen, contributes a lot to the non-communicable disease and communicable disease. Now, what is the solution? We, in Commonwealth countries, when I was the president, and we had a joint meeting with the Commonwealth, Architects Association. Every profession has an association. I was heading the medical side. We sat together and finally concluded, when you want to give a licensing for a city or a building, it should be properly planned by the health sector too. Normally architects, engineers, they go through and then they sign it, this building is there, this building is there, that my space is there for moving. No, for health of it. There should be a place for recreation, there should be a good light, and air should be clean, and water should be clean, and walking area and biking area have to be there. Only after getting a public health clearance, this has to come. And this has been accepted and is being done in developed nations. I am sure days are not far off that things will also happen in our country, and the communicable diseases already have come to 40%, should come to 0%, and non-communicable is at 60%, must come to 25%. The UN high level meeting is 25-25 is their theme, slogan, to reduce the non-communicable disease at least by 25% in the year of 2025. This cannot happen without taking into consideration of the built environment. Thank you, ladies and gentlemen.